All right, so for the next part of the examination, we're going to be looking at the spine. So the first thing I'm going to do is just looking at the overall posture of the spine. I am going to start at the C7. I'm going to palpate all the way down the spinous processes. I'm looking for feeling for any crepitus, any pain that the patient might have, any indication that the spine is displaced, going all the way down to the bottom. And then I'm also going to be feeling the paraspinous muscles, so lateral to the spiny processes. Just feeling down, feeling for any nodules or like muscles that are tight, any pain. And that all looks good. Then we're looking at the curvature of the spine. So with a normal spine, it's going to be S-shaped. You're going to have concave, convex, concave again. And up here, we'd be looking for any kyphosis and any lordosis down here, which I don't see any of those here on this individual. So now we're going to be doing the scoliosis check. So Brooks, I'm going to have you tip your chin down to your chest. Have you bend all the way forward with your hands down loose. Great. So with this, now I'm going to be taking my 2 fingers, going up the spine, just feeling for any curvature, which I do not feel. And then I'm also looking at the level of the scapula. I want to make sure that those are equal. If one was up or one was higher or one was lower, that may indicate scoliosis. Again, looking at the hips for that as well. Again, I don't see that, so you can go ahead and come up. So that was flexion of the spine. Now we want to do extension. So extension, I'm going to have you bend back. Good, great. And then I'm going to have you twist from side to side just at your hips. So I'm going to be holding on to your hips for that, for stability. Good. And then I'm going to also have you take your arms and then place them at your sides. Have you run your left arm down your leg, heading towards your knee. Okay, good. And then back up. And then we'll do the same on the other side. Good. So that again was for flexion and extension, range of motion. Now we're going to go on to the pelvic area. I'm going to have him turn around for this. So we're looking at the anterior iliac spine, feeling for that. And then we're going to go to the side, the iliac crest, which is the highest part of the iliac, the greater trochanter. And then having him turn around.